Hi all, hope each and everyone is doing well and good, and it is me Dr. Amrita here. So today we are going to discuss about all the must know and chance questions in gynecology. So this video we are going to find out the most important and the must know questions and the chance question for Neet PG 2025. So if you guys ask me how is gynec, yes, we all know that. Yes, of course, the cheese and butter. So is it easy to study? Yes, of course, it is easy to learn if you study in a wise manner. And all about this video is to find out the chance and the must know questions. So first, I will say you guys start with infertility because it is going to be very important. Infertility, you want to look about this amenorrhea thing and all those, this Mullerian agenesis, Asherman syndrome and Sewer syndrome, Turner's. So they will going to put you a clinical scenario and they will going to ask you to identify like a girl who so and so, and you want to find out. So you'll be knowing like Sewer syndrome, how it is like 46XY, MRK syndrome. So there is a very good table in your standard textbook. Please do refer it and also do MCQ questions related that. It is very important. Like in Turner's, there will be hypergonadotropis. So what is the FSH level? Yes, FSH is high there. So what happened to hypogonadism? That's all. So you can definitely expect a clinical scenario from this. So in and out infertility, and also please learn that male semen things. Now there is also a box. So what happened, that infertility wala, what is a cutoff? Just read and go that also. Then I will say that please must read HPV vaccination. That is very important, the age group and how many dose. Please read it, don't skip it. And second, I will say to you guys, please go to prolapse thing because that is very important. Here also there is a box like for what about what are the like surgical procedures and what are the methods you give for this nullipara, what is a treatment option, and what about the elderly, the prolapse things, what happened, what do you do, like in where do you give this ring pessary, and what about the pregnancy. There is also a very beautiful table, please do learn. And also the grade of prolapse is very important. In surgery I have told that they will give you a picture and ask you which grade, like bed sore, which grade, like that. Here also they can give you an image, very important, must know. Then other important is infection wala every time, that is bacterial vaginosis, that trichomonas, all time favorite, that strawberry, that's very important. Then after finishing this infection, just go with disorders of ovary. So that PCOD is going to be very important, and all those things please read. It's all time favorite. And then I will say that after reading this, go with this contraceptive wala, very important, and all the new technique wala, please learn. As well as I want to say that is Uchita technique, that's Pomeroy wala. Please learn with picture how to identify, and a short line how is like whether this stomach is cut or how is what is how to differentiate like Pomeroy from Uchida and all those things, very important. Which one is a commonly adopted measure, which is commonly done, that's very important. Please don't skip. And contraceptive era, all the new things, that hormonal thing and everything, please give importance because they can integrate with PSM and definitely can ask. Okay, that Levy Pilwala and all those things. Then that endometriosis, adenomyosis, that all you will be knowing. Please read and go. Fibroid also like sub-series, that's all thing, just read and go. And UST wala, I want to say that I just missed an OBG. That picture wala is very important. Whether is it septate, biconjugate, that all things very important, please learn it. As well as the hymen, is it a septate hymen, that's all very important. Okay, to identify this, please don't skip it. And infection wala also, genital tuberculosis, what is that UST, what is that radio picture, that is going to be very important. And that all newer techniques like HSG, what about that SHG, where do you can find it out, all those things, where you use HSG, what is the drawbacks and what all the positive things and all those things, please look that machinery part is going to be very important. And I want to say, yeah, this is what I have explained. This primary amenorrhea, there will be an algorithm for investigation, all those things, that is in a box, very important. Please do read it. Yes, that's all the must know. And after this, I will say to you guys, please give much importance for cancer wala, because cervix cancer, there is 100% sure one question from this cancer. Cervical cancer is very important. So cervical cancer, CIN. So first study cervical cancer, then study CIN, then go with that vulva, vagina, vulva cancer, then come with endometrium. So cervix and endometrium, you can like differentiate and find, because it's both easy. So that is going to be very important, because I guarantee you guys there will be definitely a question from cancer wala, that grading, that's very important, that treatment for this they will be giving, that what will be doing, what about that hormonal, that's very important. Okay. So yes, that is a must know. And also the prolapse wala I have already mentioned. Yes, that methylene blue test, that is going to be very important. That is upper, middle, that swab test, what will you get, like vesico-vaginal fistula in the middle. That's all thing very, very important, all time favorite. Then yeah, then I will say something whether I miss it or something. 1 minute, just I will look my tab actually. 1 minute guys. Yeah. Endometriosis, what do you want to know? That is endometriosis is very important. That is powder burn, lesions, chocolate, cyst ovary additions are there. That's very important. So what is a goal? See, OBG, sorry, in gynecology, definitely they will ask that investigation part. So, which is a gold standard? So, what is a gold standard? Laparoscopy is a gold standard. So, that's very important. Cancer cervix, I have already mentioned, that is stage 3B. What is the treatment option? Whether you do chemotherapy, whether do you do radiotherapy, all the mix, very, very important. And also instrument, please look everything, and also give importance for forceps wala, that outlet forceps, where do you give like a wrinkles forceps, vacuum wala, don't never ever skip. If they are planning to put an image and ask you, definitely you can predict one. And also that air spatula thing, that is going to be very important. That HPV thing, what do you do, that spatula wala, that is also important, very important. Uterine sound, Asherman syndrome, that radiographic, that is going to be important. Then what about that velamentous placenta, and all those things, unicot uterus, PCOS I have already mentioned. Yes, then contraceptive I have already mentioned, that synchroman, PCOD, that marina is all time favorite, that is copper T wala, chaya, NSC, that's a non-steroidal thing, this chaya, synchroman, that's going to be very important. Yes, that's copper T380A, LNG, multi-load, NOVA, how to identify any other newer technique, please learn it. Okay. Then the examiner's favorite is all time is over in tumor classification. I have already mentioned, that is where do you like Berners tumor, that classification wala you want to say, like sex cord stromal tumors, where what comes under that, like germ cell tumor, like teratoma is a germ cell tumor, dysgerminoma is a germ cell tumor. And what is about this Berners is actually a common epithelial tumor. So in this classification, what all things comes under, that is very important. As well as they will be like Karl-Exner bodies, how to identify that Karl-Exner's body, what is the significant thing to identify, that is very important. Yolk sac tumor, that is SD body, Schiller dual body, that is very important, just like a glomerular body. Samoma body, where do you see Ranke's crystal, where do you see clear cell tumor, you see this hobnail cell, very, very important. Krukenberg, you see signet cell, that's all always. And also where do you see that Walthout cell nest and all those things, going to be very important. And also please read that cancer tumor wala things, like inhibin is a tumor marker in where it is in granulosa cell tumor, very, very important. Okay, that Karl-Exner associated with this Karl-Exner body, epithelial tumor, that CA125, CA99, Zamomas, serous epithelial tumors, and all those things, very important. LDH plaque elevated in where? That is in dysgerminoma. See what is that lymphocytic infiltration is there. Where do you see rocky tan sky? Very, very important. That's in Berners tumor, you see this Walthout cell nest. So how to identify, that's in the histo slide, that is going to be very important. Please don't skip it. In choriocarcinoma, there is HCG is a marker. And very important, all-time favorite, that is CD99M, MIC2. Where do you see? That is granuloma. That's in granulosa cell tumor. and that collects in our bodies, coffee bean, nucleus, pseudorosity, inhibin B. Very important, inhibin B. Okay, inhibin A, I already explained in somewhere. Please read it again. A is allowed, B is banned. I have already explained it. Do you remember that where that USD wala scan time? Please don't skip it. That is going to be very important. At the same time, this vaginal infection, I have already said that is a bacterial vaginosis, trichomonas and candida. That box wala very important. Trichomonas, like strawberry, try this thing TR for trophocyte only. Okay, that is very important. Trichomonas, there is only trophocyte and there is no cyst form. Very important. And what is the drug? Metronidazole. Very important. That clue cells, where do you see? That's all very important. And also sexually transmitted, where? Is it in bacteria? Is it in trichomonas? Is it in candida? Very, very important. Trichomonas is all-time favorite question. Okay, so yes, cancer wala is very important. Please don't skip it. So instrument wala, just look. All those forceps wala very important. So I hope that this video definitely help you guys. And always be positive. Never lose your hope and always stay positive. Always avoid people with negative intention and always think you yourself and your divine shakti is there at the time of examination. So please don't ever sharpen your ears to hear everything from the negative people. Please ignore all of them and just study, and of course grace will definitely come to you. And it is me, Dr. Amrita here. And if you guys want me to put like a list of what order I should put, like surgery I have finished, OBG I have finished, gynec I have finished, patho, anatomy I have already finished, and what is the next subject you want me to put, please say fast. I will also change my routine and to try to put all those videos so quickly. And this is me, Dr. Amrita here. Thank you so much for listening. Thank you all.